Hello and welcome to Coral Gables Television Studios. I'm Brianna Moles. We invite you to reach hearts with us on this episode of Coffee Talk, your source for the latest local news in Coral Gables and South Florida. We all know that living around Miami means you're usually showing some skin to try and stay cool from the heat. So if your sun-kissed skin is your most fashionable accessory, you definitely don't want to let big red bug bites ruin your look. And more importantly, you don't want to be the victim of a mosquito-borne disease that's creeped into our area. Joining us now is Dr. Alvaro Mejia-Echeverry, a medical epidemiologist for the Florida Department of Health in Miami-Dade County. Thank you so much for being here with us, Doctor.
Our pleasure. Thank you for inviting us.
Of course. So now that this mosquito-borne disease alert has been officially issued for the county, the illness is called dengue fever. How serious is this disease, and what are some of the main symptoms people should look for?
Right. Thank you for the question. Well, dengue is usually not a serious disease, especially when you have the first episode of dengue. And it's important to say you can have up to 4 episodes of dengue in your lifetime, because there are 4 dengue viruses known to humans so far. So it's a disease that, while it's usually not lethal in the first episode, except for certain groups, it's very incapacitating and can put a person in the hospital for maybe 1 week, 2 weeks, which may represent an important strain for a family. So there are definitely measures that people can take to remain healthy, and even though we have the mosquito in our area, there are many measures that people can use to protect themselves.
What are some of the main symptoms? Can you describe those for us, what people can look out for in case they think they might have dengue fever?
Right. Dengue is a tropical disease. That means that it's a disease that usually happens in warm areas of the world, like the Caribbean, certain African and Asian countries, and South America also. And of course, Miami is one of the tropical areas of the world. The mosquito that transmits dengue is called Aedes aegypti and Aedes albopictus. There are 2 types of mosquitoes. They live here in Miami. The good thing about those mosquitoes is that we keep them at bay, because Miami-Dade has a very effective mosquito control system that fumigates and follows a protocol whenever a case is reported. That's something important to say before I start describing the symptoms. So dengue is a febrile disease. Most of the times people have fever, headache, and an important sign that is very characteristic of dengue is body aches or bone pain that people call break bone fever, because your joints are usually very painful. And that's what usually incapacitates a person to the point that it puts them in the hospital for, again, it could be up to 4 weeks, for example. So that's the most characteristic of dengue, but it can also present with a rash that usually doesn't last very long, maybe 2 or 3 days or less. And that's why some people may not have a chance to observe the rash, but that's definitely something that doctors look for when they are evaluating a patient suspect of having dengue.
If people think they've been bitten by a mosquito that has the dengue fever, will the symptoms show up immediately after they've been bit, or will it take a few days for them to start to see symptoms?
It usually takes a few days. The incubation period of dengue, is the time between the exposure to the mosquito bite to the moment that symptoms start to appear. Can vary between 5 and 7 days, but we extend it to up to 14 days. Okay. So when a person doesn't present, when the symptoms are related to a mosquito bite but are beyond 14 days, we usually think of other diseases. And another important symptom that it's important to highlight is the type of headache. Very frequently this headache presents as a pain behind the eyes that physicians know as retroorbital pain, means that it's behind the orbits or the places where the eyeballs are sucked. So that's a very characteristic of dengue as well. In the majority of cases of those who do get symptomatic, people can go by with regular prescription for fever-reducing medication and hydration measures and rest. So the doctor, depending on the condition in which the doctor found the patient, they may be able to manage them at home with home care, or if the patient is an immunocompromised patient or is from the elderly group or the or an infant, then of course that person may be better at a hospital for support measures. It's important to say that there is no specific treatment for dengue. There is not an antiviral that kills the dengue virus, and there is no vaccine, even though we have some candidate vaccines that are now undergoing trials. And so that's important to know, but so far we don't have either or vaccine or treatment.
So it sounds like it really depends on each patient specifically and individually in terms of treatment. And so how many people in Miami-Dade County so far have contracted the disease?
During this year, we have reports of 25 people that have contracted the disease, but out of those 25, 21 are imported cases from the different areas that I just mentioned, and 4 of them have been locally acquired. That means that people have not traveled to endemic area. They were bitten by local mosquitoes, domestic mosquitoes that we have here, and that's how it was transmitted.
Obviously, the most important thing is to be, more safe than sorry. So, and I think it's all about prevention in this case, protecting yourself from getting these mosquito bites. What are some of the main recommendations and precautions that the Florida Department of Health is telling people?
Precautions are summarized in 2 words: drain and cover. When we say drain, we refer to draining, especially measures that have to do with the house and its surroundings. The front yard, the backyard. When we talk about the backyard, make sure that you don't have disposable items like tires, plant pots, bird baths, boats that are improperly covered, swimming pools that are improperly maintained. So plant pots, please get rid of them. Don't store tires in your backyard. Those are the main mosquito breeders. Bird baths, again, and maintain a good gardening. Make sure that you cut your grass often. Make sure that you clean your gutters. Those are the measures of draining. When we talk about cover, we refer to 2 environments or 2 settings: is the house itself, and of course the body. So when we talk about the house, the cover of the house is making sure that your window screens are integer, that they don't have holes, that they that allow the entrance of mosquitoes. If you're going to open your doors, make sure that you have a screen that covers your door. And if you need to open your windows because of whatever reason, make sure that has all the screens, especially during this hot season. When we talk about covering your body, is covering your body with clothing and repellent. So the clothing is when you need to go outside to do physical activity, make sure that you wear long sleeve, fresh long sleeve, like to go jog or to go walk, and that you apply repellent. That's the other part of the covering. When you apply repellent, make sure, and this is a message that is important to stress, don't allow your children to apply the repellent themselves, because it can become counteractive and cause them health problems. The repellent is worn in a way that you should decide what you're going to dress, and once you're dressed, you apply the repellent in the uncovered skin, and then you apply it on top of the clothes. But never apply repellent before you put on your clothes, because it can build up and cause untoward effects. Because
it is toxic. Repellent in itself, in its nature, is toxic.
Right. Yeah. If you apply it correctly, that level of toxicity is not of concern.
You basically just want to cover the outside layer of you. So whether if your skin is exposed, then your skin, but if not, then just the top layer of your clothing.
When you're going to apply repellent in your face, don't spray directly in your face. Just spray it on your hands and then put it on your face. And the same with your kids. Don't. You're the one that has to apply the repellent on your kid, especially on children, and then apply the repellent on top of the clothes, because mosquitoes bite you through the clothes.
Oh, wow.
They have the capacity to bite you through the clothes. Yes.
Wow. And I know it's recommended that bug spray with concentrations of at least 30% DEET is what is recommended?
Yes, DEET is one of the approved repellents and recommended repellents by the CDC and the FDA, or also lemon eucalyptus oil. That's another repellent that is very well recommended for those people who don't want to use or
the chemicals. They can
go more with the natural repellent.
Sure.
As the lemon eucalyptus oil is another option.
And the natural alternative was also good because obviously infants and really small children shouldn't have, high concentrations of DEET sprayed on them. It's just a little too dangerous at that young age, so it's better to have a natural alternative for them. Okay, thank you so much, doctor, for being here with us. I know we've learned some really helpful tips to stay safe. If you'd like more information on how to protect you and your family from the mosquito-borne disease alert, visit dadehealth.org or floridahealth.gov. Remember that you can now watch us on UVerse Channel 99 and Comcast Channel 77 or on demand at coralgables.com. And also be sure to follow us on YouTube by subscribing to our channel at youtube.com/CoralGablesTV. That's all for this edition of Coffee Talk. For Coral Gables TV Studios, I'm Brianna Moles. Thanks for watching, and we'll see you next time.